The CO2 laser, or commonly referred to as Mona Lisa Touch, is a laser that treats what we call genitourinary syndrome of menopause. So the old term is atrophy. That term we got rid of a long time ago, but sometimes it still sticks around. What we're doing is we're rebuilding collagen in the vulva and the vagina. When you rebuild collagen, you make the skin stretchy again. You also bring in blood vessels, which brings in moisture. So it's creating new skin that gets the patient moisture, stretchiness, and she can get rid of a lot of the symptoms that she's having. So the laser can treat other conditions. It has the most data with regard to the changes that women have after they go through menopause, so genitourinary syndrome of menopause. It also may treat lichen sclerosis and lichen planus, which are two skin conditions that women can develop and changes their architecture of the skin, causes itching, causes burning. And then finally, some women benefit in what we call minor stress urinary incontinence, so that cough, sneeze, laugh, lose urine kind of treatment. But there's less data for that than there are for the first options. The course of treatment with a CO2 laser is usually first an evaluation to make sure the patient is a candidate for that. Then they would have 3 treatments done 6 weeks apart. And the treatments involve a vaginal treatment with a vaginal probe and a vulvar treatment with a vulvar probe. It's painless, it takes less than 10 minutes. And the patients typically, once they have the treatment, feel like they have a sunburn for the first 24 to 48 hours. We have them put a moisturizing cream on that area, and then they're back to their normal life very, very quickly. So regarding payment options for this particular treatment, we allow the patient to check their insurance and see if they have covered benefits for this particular treatment. So we give them some codes, they check their insurance. As long as they met their deductible, then it can be a covered treatment.